Hi, this is Doug and Steve from the In-Training Running Injury Clinic. We help runners manage their running by providing training programs, the right footwear, injury advice, and rehabilitation management strategies. Keeping you on the road to reach your goals and enjoy running is our highest priority. And today, Doug, we're going to talk about, is running bad for your knees?
That's a very good question, Steve, and it's certainly a bit of an urban legend or a bit of an old wives' tale that gets thrown around a fair bit by usually well-meaning people. If you want to
That's
know.
true.
But yeah, we're going to try and debunk whether it is actually true or not.
Yeah, so I know so many people most runners, I would probably say, have had someone tell them that they're going to wear their knees out, and if they keep running so much. And so the medical profession believed that for a long time.
Oh, that's
so
crazy. Yeah.
And so the normal advice, if you're running and you had sore knees, is to stop running, wasn't it?
That's it. Yeah. I mean, we're not motor cars. We're not machines. We self-repair.
Yeah.
In fact, often loading our joints and bodies leads to some positive outcomes.
Mm-hmm. So there was basically the story of how we figured out what was the best way of dealing with knees when it comes to runners. Is that there was a doctor who was an orthopedic surgeon, and he had regularly told his patients to stop running when they had sore knees. And what he found was that, he suddenly realized that the people who ignored him and actually kept running were doing a lot better than the people who had stopped running.
Wow, isn't that crazy?
Yeah, and then there's more studies after that point, wasn't there?
Oh, absolutely. Even more recently, they managed to get a bunch of volunteers that were about to run the London Marathon a couple of years ago. They were able to get them into an MRI machine. They had 82 runners go in, and they sort of did. They found that a lot of people had some sort of wear and tear in their knees. There's going to be a bit of wear in the cartilage, maybe a bit of swelling in the bone. But they did that 6 months before the running, so just before they were really embarking on their training. And then they did another study again 2 weeks after they'd finished the marathon. And the findings were that a lot of the bone swelling, so the things that you'd think would be causing damage, was actually improved following the marathon.
Yeah, it's amazing. And you'd think that the marathon itself would have caused some damage. So
for sure, it's a long way and a lot of stress on bodies, but we're remarkably adaptable beings. So 6 months of training, people's knees actually got better from it.
Yeah, and there's another study that was done on 65-year-olds where they basically had MRI studies of all of these 65 and plus year olds, so up to I think 80 people in their 80s anyway that were in the study, and they all had MRI findings of lesions in their knee joints. And what they did is they split them into two groups. So half the group just continued doing what they normally did, and the other half started on a 12-week running program. And they weren't doing a lot of running. It was probably 1 or 2K a few times a week. But after the 12 weeks, they did the MRI of them again, and they found that the people who had started the running program, those lesions actually got smaller.
Oh, wow.
So it actually is a treatment for osteoarthritis, can be weight-bearing activity.
Absolutely. So it does help. What they understand is that you need impact, you need loading on the joint for moisture to be basically absorbed into the cartilage, and it actually helps to strengthen and improve the quality of it in a lot of cases.
Yeah, and it's actually the subchondral bone that you improve the bone density through weight-bearing activity, and it has to be above 2.2 times your body weight. So walking unfortunately isn't enough impact forces to get the adaptation. But when you do that, your bone's really actually pretty amazing at adapting to stress. And so one of the things that it does is improves your bone density below the cartilage, and that's where all the nutrients come. There's no nutrients that the cartilage gets from the joint itself. It's not through the synovial fluid, it's actually from the bone underneath it.
Yeah, no, a really important point. And I guess the other consideration is, you can do all these studies, but even if it does look bad on an X-ray or an MRI, it's not to say that you're in pain. So the studies there should be taken with a grain of salt. Yeah,
I think if we MRI'd everybody, we would find so many problems with them that that would be an issue that you would think, well, maybe you have to do something to correct that.
Oh, absolutely. And as clinicians, as a podiatrist, as a physio, we'll often send people off for a scan of their knees, and they'll be in a lot of pain, but it comes back there's nothing wrong. It shows there's nothing wrong on the scan. So I think a lot of people can be misled by that in both categories. So if a doctor's looking at something and says, "Oh, your knees are terrible, never run again," I think that's not always a valid reason to go off just with the imaging alone.
Yeah, look, people are often jump to the suggestion that you just should stop running, and in very many injuries, that's actually not a good way of doing the treatment. You really need to use it or you lose it, and you need to use it to get the strength for it to repair. And even things like tendon injuries, complete rest isn't necessarily a good thing for extended periods.
Absolutely, it's often a waste of time as well. So rather than getting better, you're actually probably getting worse, and it's going to take you much longer to get back to running again.
I think the only thing that people have to understand is if there's some major trauma to their knee, or if the knee's really hurting a lot, that they shouldn't be pushing through that pain, because they could actually lead to more injury, couldn't they?
Absolutely. So there's a few cases, I guess. If there is sufficient cartilage wear or thinning, then there's probably there is definitely reason to lay off the running. There are alternate weight-bearing exercise that could happen. But that's not always a life sentence, So people do come back from those sorts of injuries, even if it does look fairly dire on the scans.
Yeah.
The other consideration is, I guess, if you are running in pain that gets progressively worse with the run, you can have some things like ITB injuries, which it's not particularly serious in the structural sense of the injury, but it's quite painful. And would certainly force you to change the way that you're running, which can lead to other injuries.
That's right, yeah. You don't want to be limping because of pain that then means that you hurt something else because you're overloading that new structure. So.
Oh, absolutely. So I think if we can summarize and say that running is not bad for knees. Running with an injury that changes the way that you run is bad, but otherwise I think we've got to get rid of this myth that running is bad for your knees.
Yeah. So I guess if you have some sore knees and you want to see if it's safe to run or not, that's where you can come into the clinic, and there's so many different things that we can do. Certainly footwear is one of them.
Oh, absolutely. The right pair of shoes can make a huge difference. Equally, if it's not just the shoes that are making a difference, we can improve it further by looking at an orthotic or an insert for the shoe.
Yeah, and I think the other really important thing is strengthening. So it's amazing how much control you can have around the joint just by strengthening the muscles around it. So that if you do that strengthening before you run, then you might find that you don't strain it as much.
Oh, absolutely. I mean, it's helped you a lot coming back from your knee injuries.
That's true.
Can help runners to keep running into the later years of life.
Yeah, especially as you get older, you lose muscle mass, and that's where I think the strength and conditioning becomes more and more important if you want to maintain easy, injury-free running.
Absolutely.
So thanks everybody for joining us, and this is Steve and Doug in Training Run Stock. Thank you.